Welcome. I am Terry Tropin, and today I'll be discussing the changes to ICD-10-CM for 2024. These are effective October 1st this year, so you need to become familiar with them. First, let me tell you a little bit about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus. I have RHIA and CCSP certifications. I'm also a HEMA-approved ICD-10 trainer. I used to teach at Montgomery College, but I am now retired. I've also written books. These are study guides, kind of taking complicated guidelines and making them easier to understand. I have 3 books: Evaluation and Management Coding, ICD-10-CM, ICD-10-PCS. This one has been updated for 2024, the PCS book. The CM book will be updated in early September. These books are available on Amazon, updated every year or as needed. Okay, so what am I going to talk about today? First, I'll discuss changes to codes for specific conditions. Previously, many of these conditions did not have specific codes and thus fell into the other specified category, which could be anything. So now I have more specific information about these conditions. Other codes were already in the CM book, but they were expanded. New codes were added to provide additional information about the condition. For example, code N06.2, glomerulonephritis, was expanded to include specific types such as primary and secondary. Some of the codes have changes in both the guidelines and corresponding changes in the tabular list. So new codes were added for examinations, encounters, screenings. Other codes were revised. There are also new and revised codes for risk factors. And also there were changes made to the notes in the tabular list. For example, excludes 1 notes changed to excludes 2 notes. These are really important and really easy to miss. These will also be discussed. So in this presentation, new codes or guidelines are underlined. Deleted information is crossed out. First, let's start with Chapter 2, Neoplasms. So previously, these were inclusion terms under D13.9. Now it has its own code: familiar adenomatous polyposis. So this has its own code now, and then you have other conditions. But this is now a specific code. Also added to Chapter 2 are codes for desmoid tumor. Previously, there were no codes for this condition at all. It was just under uncertain behavior of connective tissue, another soft tissue. So now you have a specific code for this, and not only that, you have where the tumor is located. So from nothing at all to very specific codes. This is a non-cancerous growth in connective tissue, desmoid tumor. Here's an example of an existing code that's expanded to include more information. This is in Chapter 3, blood and blood-forming organs. So the whole category, D57, sickle cell disorders, they added codes throughout this category for dactylitis in D57.2, D57.4, and D57.8. So this is a condition of swollen, painful fingers, a common condition associated with sickle cell. So there are a number of changes in Chapter 4, endocrine, nutritional, and metabolic diseases. The codes for hypoparathyroidism, E20.8, were expanded to include the cause and type of the hypoparathyroidism. So you have autosomal dominant, you have autoimmune, you have impaired hormonal secretion unspecified. So a lot more very specific, a lot more detail. Most of these codes we're going to talk about just are adding a lot of detail. Also, in chapter 4, added a code to E74.0 glycogen storage disease. A new code under that is for LAMP2 deficiency, lysosome-associated membrane protein, E74.5. This is a condition with severe cardiomyopathy, muscle weakness, often intellectual deficit. It's also called Danon disease. A lysosome is something inside a cell. So now you have a specific code for this. So other codes were added to E75.2, other sphingolipidosis. For example, we have Pelizaeus-Merkbacher disease. This is an inherited, degenerative, progressive central nervous system disorder that affects coordination, motor abilities, and cognitive function. We also have a new condition, the Canavan disease, also inherited neurological disorder. The brain degenerates into spongy tissue full of small fluid-filled spaces. So this is E57.2 sphingolipidosis. So what are those? Those are disorders that allow accumulation of harmful substances of glucose sphingolipids and phosphorus sphingolipids. And this causes these conditions. Okay, E79.8, other disorders of purine and pyrimidine metabolism. The metabolism of these conditions results in uric acid, which is a component of urine. So you have Acades-Guterres syndrome, affects the white matter of the brain, mild to severe intellectual development and physical impairments. You also have hereditary xanthorrhea, also gene mutation, mental delays, autism. So now specific codes for these conditions that we didn't have before. Okay, there are also a number of changes to Chapter 6, diseases of the nervous system. Under G11, hereditary ataxia, there was a code added, G11.5, hypermyelination, hypogonadism, and hypodontia. This is also called the 4-H syndrome. So 1, 2, 3, 4. So this is the body's not producing myelin, which is protects and insulates the nerves. Hypogonatropic hypogonadism, little or no sex hormones, and hypodontia, missing teeth, missing permanent teeth. So all of these H's have to be met in order to report this. Also in category G11, hereditary ataxia, is a code G11.6, leukodystrophy with vanishing white matter syndrome. So white matter, pretty self-explanatory, white matter, gray matter. Leukodystrophy is an abnormal growth of the white matter in the brain. Vanishing white matter disease, body cannot make enough myelin. Remember that supports and insulates the nerve cell. Okay, also in Chapter 6, G23.8, hypomyelination with atrophy of the basal ganglia and cerebellum, HABC disease. So this occurs around age 1, so development slows, and you can see that basal ganglia is right here in the midbrain, and these control movements. Again, in Chapter 6, G37.8, other specific demyelinating disease of the central nervous system, myelin oligodendrocyte glycoprotein antibody disease, MOGAD. So it's an inflammation with demyelination of the optic nerve, spinal cord, and or brain. So the oligodendrocyte is the cell that produces the myelin. So if the problem with that, then you're not going to get the myelin. You're not going to have the protection and the insulation of the cell. Okay, Parkinson's disease. This G20, of course, Parkinson's disease was already in the book, but this has added a lot of specificity. So you have Parkinson's disease without dyskinesia and Parkinson's disease with dyskinesia. And under each of those, you have with and without mentions of fluctuations. Fluctuations means changes in the ability to move. Sometimes the patient can move better than others. Dyskinesia, of course, is the abnormal involuntary movements that are basically a part of Parkinson's disease. So the new code for Lafora progressive myoclonus epilepsy. So G40.C, so this is a specific type of epilepsy that was not codable in the 2023 version. So under G40.C, there's codes for intractable, non-intractable, with and without status epilepticus. And what is this condition? Well, it's a recurrent disease. Seizures occur with decline in intellectual function. Usually occurs in late childhood or adolescence. A number of codes were added under subcategory G93.4. We have G93.42, megaloencephalic leukoencephalopathy with subchordal cysts. G93.43, leukoencephalopathy with calcifications and cysts, and G93.44, adult onset leukodystrophy with axonal spheroids. So leukoencephalopathy is the conditions of the white matter of the brain. So 3 new codes under other and unspecified to make it very, very specific. Now let's move on to Chapter 7, Diseases of the Eye and Adnexa. So this H50.6 is already in the book, Mechanical Strabismus. This involves the action, the movement of the eyeball. So we have under here different muscles and entrapment. This is abnormal muscles, or it could be craniofacial malformations that trap the muscle, that restrict the muscle, or orbital trauma, that injury which restricts the muscle. So you can see the very, very specific muscles, and those muscles are shown in the picture, so you can see which one they're talking about. Inferior oblique, inferior rectus, superior oblique, superior rectus, etc. So very, very specific codes. Okay, this is interesting. There are a number of places where they added codes for foreign body sensation. Chapters 7, 18, and 20 talk about foreign bodies. This could be that they feel like there's something like foreign body sensation, but it's not there, or there is one, but there's no injury due to it. So under H57.8, H57.8A, foreign body sensation in the eye, you have the right eye, left eye, both eyes. These codes are different from injury from foreign body. These are coded to Chapter 19. Foreign body sensation was also added to Chapter 18, Symptoms, Signs, and Abnormal Clinical and Laboratory Findings. RO9.A, foreign body sensation of circulatory and respiratory system. You have specific codes for nose and throat and other site. So these are it's very, very specific, well, more specific anyway, of where the foreign body is. If a foreign body is actually present, you can use the external cause codes from Chapter 20. So there's a whole new category, W44, foreign body entering into or through a natural orifice. You can see in the picture this kid who swallowed a paper clip, a toy, a coin. So you have specific code for battery, plastic, glass, magnetic metal, non-magnetic metal, natural organic material, sharp object, foreign object. So there's specific codes under each one of these subcategories. So they divided even further. Specific codes for a coin, for a rubber band, plastic toy, cylindrical battery, etc. Okay, let's move on to Chapter 9, Circulatory System. Changes were made both to the guidelines and the tabular list to include hypertension resistant. So the guideline reads, resistant hypertension refers to blood pressure of a patient with hypertension that remains above goal in spite of the use of antihypertensive medications. So the patient is getting medication, but it's not having the effect that they want. So there's a new code, I1A0, resistant hypertension, and this is used as an additional code. So first you code the hypertension, and then you code the type of hypertension, and then you code that it is resistant. So in the tabular list, you have I1A.0, resistant hypertension, and there's a note there that also reminds you for code for a specific type of hypertension if known. A new guideline, a new code were also added in this chapter for microvascular dysfunction. So the guideline says microcardial infarction with coronary microvascular dysfunction. Coronary microvascular dysfunction is a condition that impacts the microvasculature by restricting microvascular flow and increasing microvascular resistance. So the resistance to the flow, so that it's not flowing as it should be. Code I21.B, myocardial infarction with coronary microvascular dysfunction, is assigned for myocardial infarction with coronary microvascular disease, myocardial infarction with coronary microvascular disease, and myocardial infarction with non-obstructive coronary arteries with microvascular disease. So here are the codes that include new codes for microvascular dysfunction. You have a code under other forms of angina pectoris, I20.81. You have a code under acute myocardial infarction, I21.B. And you have a code under I24.A, acute coronary microvascular dysfunction. You can see here's the heart. Here's the macrocirculation, the bigger vessels, and then you have the micro vessels, and like here is where there's a dysfunction. A code was also added to category I47, paroxysmal tachycardia. So you have I47 and I47.1, supraventricular tachycardia, and then I47.11, inappropriate sinus tachycardia, so stated. So sinus tachycardia is an abnormally fast heart rate, sometimes in response to stressful situation. Hopefully it returns to normal, and it affects the sinus node, which is here. Okay, Chapter 10, diseases of the respiratory system. You have a new code under J44.8, other specified chronic obstructive pulmonary disease, J44.81, bronchiolitis obliterans and bronchiolitis obliterans syndrome. So this is shortness of breath, dry cough, wheezing, the buildup of scar tissue, obliterans means obliterates. So it's first discovered in workers at a microwave popcorn plant who had inhaled a flavoring chemical. So sometimes it's called popcorn lung, kind of a cutesy name for a condition that is quite serious. Another new code under J44.A, J4A.0, restrictive allograft syndrome. This is the most common cause of mortality in lung transplant recipients after the first year of the transplantation. So what happens is fibrosis forms in the peripheral lung, and that's indicated in this picture by the white part. So you can see that the capacity of the lung to take in air is decreased. See, it's much less than it should be. So bronchiolitis obliterans is there's obstruction of lung bronchioles. Restrictive allograft syndrome, there's a restriction. So there's the capacity of the lung is decreased. Okay, this condition, Acinetobacter baumannii, bacteria, is mentioned both in chapters 10 and chapters 21 in the 2024 version. So in chapter 10, it's pneumonia due to this bacteria, J15.61. So this is new. This bacteria is usually hospital acquired. It's also mentioned in chapter 21, factors influencing health status and contact with health services. So it's listed here for patients who are a carrier of this bacteria. So it's mentioned, and codes were added in 2 different places for this. Okay, so let's go on to chapter 11, diseases of the digestive system. So we have a new code, K63 under 82, under other specific diseases of intestine. Now, of course, you're supposed to have bacteria in your intestine. This is good. But if you get too much, you got a problem. So there's small intestine bacterial overgrowth, which was added, and there's specific types of overgrowth: hydrogen subtype, hydrogen sulfide, and unspecified. So what happens with this? Well, flatulence, abdominal discomfort, diarrhea, or constipation. Okay, so also in digestive system, we have short bowel syndrome. You have short bowel syndrome with colon in continuity, short bowel syndrome without colon in continuity, and unspecified. So not enough intestine is there to absorb nutrients. This often occurs after surgery. So you can see in this normal one, look at all that area that the nutrients can flow through and then be absorbed into the body. In this one, not so much. So there's not enough there to absorb all the nutrients as needed. So let's move on to genitourinary system. NO2, recurrent and persistent hematuria, had a code added under that, NO2.B, recurrent and persistent immunoglobulin A nephropathy. Immunoglobulin A is a protein that builds up in the kidneys and can cause inflammation. So under this, they also added new codes for the type of nephropathy with types of glomerular lesion, glomerulonephritis. So lots of new codes in this section too, so very, very specific. Also in this chapter were codes added to NO2.4, nephrotic syndrome with diffuse membranous glomerulonephritis. So you have unspecified, primary, and secondary. So that's the major additions in here. New codes were also added to NO6.2, isolated proteinuria with diffuse membranous glomerulonephritis. So isolated proteinuria, of course, is protein in the urine, but without abnormalities of urinary sediment, hematuria, and or hypertension or diabetes. So it's isolated. The only really condition is the proteinuria, but there's not these other problems. So you see that they've added under this with isolated proteinuria, primary and secondary. Okay, let's move on to chapter 15. A new code was added for intrahepatic cholestasis of pregnancy. So this is a liver disorder with pruritus, itchiness, increased serum bile acids. And you see there's codes, of course, for first trimester, second, third, and unspecified. Also in pregnancy, you have a code added to 090.4, postpartum acute kidney failure in the purpureum category. hepatorenal syndrome following labor and delivery, and other postpartum acute kidney failure. So signs of liver failure, decreased urination. That's under chapter 15 for pregnancy. Moving on to chapter 17, other congenital malformations of liver. So they've added something to a specific code for Alagille syndrome. The bile builds up in the liver because there's too few bile ducts. Here are the bile ducts, and if you don't have enough of these, it's not going to drain correctly. Also in this chapter are new codes for craniocytosis, which is a birth defect in which the bones of the baby's skull join together too early. When this happens, the brain grows and there's not enough room, and the skull can become misshapen. You can see under craniocytosis new codes for the specific suture that is the problem, that has joined together too early, and sagittal, coronal, multi, and these, you can see all of these listed here. So under Q87.8, there's a number of different conditions that have been added. Q87.83, Bardet-Biedl syndrome, Q87.84, Lawrence-Moon syndrome, and Q87.85, Med13L syndrome. And here's a description of these. So added to subcategory Q93.5, you have Phelan-McDermott syndrome, it's chromosome deletion, lower weak muscle tone, developmental delays. So chapter 18, we'll go on to now, has some important changes to coma guidelines. You look at R40.20, unspecified coma. Before it said may be assigned in conjunction with codes for medical condition. Now it says should be assigned where the underlying cause of the coma is not known, or the cause is a traumatic brain injury and the coma scale is not documented in the medical record. So this is changed. If any medical condition is changed to underlying cause of coma is not known, or there's no coma scale documented. Also added was coma scale codes cannot be used with R40.2a, non-traumatic comas due to underlying condition. The coma scale codes are primarily used by trauma registries. So to correspond with this new guideline, there's a new code in the tabular list, R40.2a, non-traumatic coma due to underlying condition. So this is not due to an injury, due to another condition. Also added to chapter 18, this is interesting, the mammographic density. There's a breast imaging reporting and data system that uses numbers. They're very specific about the density and the prognosis. So you can see in these codes, they have letters and numbers. The letters indicate the density, the numbers indicate density, the letters indicate the prognosis. So you have mammographic fatty tissue density, mammographic fibroglandular density, mammograph heterogeneous, and then extreme density. So under each one of these codes also there's a code for right breast, left breast, bilateral. So much more specific than just density, which was abnormal conditions. Then they added a density and then very specific codes under that. So that's all the codes leading with specific conditions. Changes were also made to the codes for examinations, encounters, and screening. COVID-19, they deleted this part about the pandemic. It says during the COVID pandemic, a screening code is generally not appropriate. Don't use Z11.52. So apparently the pandemic is considered to be over, so they deleted all of that and they added for screening for COVID-19, including preoperative screening, assigned code Z11.52 and counter for screening. Now you notice that before they said don't use that code, and now they're saying use that code. So the code was already there before they just told you not to use it, which is interesting. A code was also added for encounters for HIV pre-exposure prophylaxis, so preventative care. In the guidelines it says when a patient is seen for administration of pre-exposure prophylactic medication for HIV, assigned code Z29.81, this is intended to prevent infection in people who are at risk for getting HIV through sex or injection. Risk factors should also be coded. So in the tabular list, they added a code Z29.81 and counter for HIV pre-exposure prophylaxis. And they also said, again, put in those risk factors. Why does this patient need prophylaxis? Well, possible risk factors. In Chapter 21, the guidelines for follow-up examination were revised. It was clarified that follow-up exam codes Z08 and Z09 can be used for conditions other than malignant neoplasms. The follow-up may be for completed surgery or maybe for medical treatments, surgical treatments, whatever. Is follow-up for any condition, not just malignant neoplasms. So also in Chapter 21, they added a new code. I thought this was interesting. JO 5.81, observation and evaluation of newborn for specific suspected conditions ruled out. GO 5.81 is observation and evaluation for suspected conditions related to home physiologic monitoring device. So monitoring devices include pulse oximeter, cardiopulmonary monitors, that kind of thing. So conditions where they thought it caused a problem, but it turns, fortunately, that it's been ruled out. There also are codes for examinations and encounters for risk factors. So they changed the guidelines for risk factors. So social determinants of health, these are kind of, the first couple of changes are just kind of editing changes. The important part is this part down here. Documentation by a clinician or patient-reported information that is signed off by a clinician that the patient expresses concern with access and availability of food would support assignment of G75.41, food insecurity. So if the clinician sees it or the patient says, I'm worried about getting enough food, you can use Z59.41. The medical medical record documentation indicating a patient is homeless would support of a code from subcategory Z59.0, homelessness. So it has to be documented, and that would support homelessness, reporting a code of homelessness. The codes for caregivers' noncompliance with patients' medical or other treatment have been expanded. So look at Z91.84, noncompliance with patient's medication. So it's due to financial hardship or for other reason. Compliance with patient's renal dialysis, financial, other, patient's other medical treatment, financial or other. These make these codes consistent with the other codes in this subcategory, which already have this financial or other information. So it's kind of making everything consistent. So that's all for the codes for risk factors. Changes were also made in the tabular list for codes, for the notes under the codes. These changes may seem minor, but they're really important. They affect how the codes are listed on the claim form and whether or not the codes can be listed on the claim form. Remember that excludes one means only one code can be reported. Excludes two mean that if appropriate, two codes can be listed. Code first says you gotta list the code there first. Use additional list the code that it can't be listed first. The code also lists codes listed in any order. So let's take a look at those. I'm just giving examples because I could go through, spend an hour going through all of these, and you don't want that. Okay, let's look at D12, benign neoplasms of colon, rectal, anus, and anal canal. This was changed from, the note was changed from excludes 1 to excludes 2. So when it excludes 1, you can do either or, a code from D12 or a code from D3A.2 or K63.5. In this case, you can use an excludes 2. So if the documentation is there, you can code both. So here's another example. In this case, an excludes 2 was changed to an excludes 1. So you cannot now report an 81.6 with an 81.2 or 0.4. You've got to pick whichever one is most appropriate. Another example is a use additional code note. Under D70 point neutropenia, use additional code that tells you the use neutropenia code and then the additional mucositis code. In this case, the order is up to the circumstances. D70 first and then the mucositis, or the other way around. It depends on the circumstances. So I think the biggest change is that the notes under these categories have been deleted. The note said, use additional code to identify exposure to environmental tobacco smoke, smoke in the perinatal period, history of tobacco dependence, occupational exposure. So these used to be under all of these codes in J31, J32, 33, 35, 38, 43, and 43, so 44, so codes in the respiratory system. So this note was deleted. So you can't remember all the changes. So first go to the codes that you use often, underline or highlight the changes to make notes next to the codes. Look also at the codes you use often to see if there are changes to the notes under the codes. So again, here are the books that I have written. Here is the link to it. The link is also written in the description. So if you'd like to contact me with comments or questions, here is my email. I'm also on Facebook, email. If you want a copy of these slides, give me a thanks and send me your email address, and I will send you a PDF of the slides. These are updated every year or as needed, the books. Thank you very much for watching. If you have comments, please feel to contact me. Hope this was useful. More videos coming soon. Thank you.